So I would like to give a brief presentation on our work in the lab, primarily on novel fluorescence probes. I've got interested in this topic about at the beginning of the 2000s, nearly 17 years ago, when I was involved with developing mouse models of pancreatic cancer that expressed either green fluorescent protein or red fluorescent protein, as you can see on the slide here. And this little video of one of the surgical residents creating one of these mouse models. They do a little mini laparotomy, pull the pancreas out, inject some cell lines. Now the cell lines have been stably transfected with the fluorescent proteins. And then they just tuck the pancreas back in to the animal. And then they develop the tumors as you saw. We realized, though, that was a little artificial, and we weren't sure how we could do that in a patient someday. So around 2008 or so, we started looking into fluorophore conjugated antibodies, and this was our first paper on using a CA19-9 antibody, which is commonly overexpressed in pancreatic cancer, tagged to a green fluorophore. And we were able to deliver that to a mouse, and we could see micrometastases that had developed on the peritoneal surface. And we did the same thing with anti-CEA antibody for imaging both pancreatic and colon cancer in mouse models, and you can see, again, that you could light up the tumor burden very nicely. And if you remove the tumor, sometimes there was residual tumor that you didn't see with the naked eye that could be detected with the fluorophore conjugated antibody. So we started progressing, and these were just mouse antibodies at that time, so we linked up with a collaborator who had a chimeric antibody to anti-CEA, so it was sort of a mixture of a mouse antibody and a human antibody, chimeric, and that would be more clinically appropriate for patient use someday. And we were able to show that the chimeric antibody was actually better than the mouse antibody at fluorescing colon cancer, and in this slide here, pancreas cancer, and even lung cancers that overexpress CEA. Just another example of a orthotopically placed colon cancer, and the mouse was given the anti-CEA chimeric antibody, and you can see how well the tumors were delineated there. One of the residents in the lab, Christina Matilde, performed a study that took her almost a year to do and was published in the Annals of Surgical Oncology, where she took 73 mice and then randomized them after implanting pancreatic cancer into their pancreas into different treatment groups, including no treatment, gemcitabine only, bright light surgery with post-op gemcitabine, and then fluorescence-guided surgery with post-op